Thank you for your time and interest in learning more about our QI project on registration of newly diagnosed children with autism spectrum disorder and developmental disabilities at state regional offices. My name is Dr. Whitney Rawling, and my co-author is Dr. Rachel Goodson. In fiscal year 2020, 32,220 Missouri residents utilized developmental disability services through the Missouri Department of Mental Health. Disability services account for 53% of Missouri state mental health funding. Physicians and psychologists are required for making eligible diagnoses, but registration for state support is patient-dependent and can be perceived as an extensive paperwork process. Our project goal is to measure and increase the percentage of eligible patients registered for their state mental health resource offices. Children's Mercy Developmental and Behavioral Health D&B clinic physicians and psychologists were surveyed about registration status of their patients with autism spectrum disorder, ASD, and/or developmental disabilities seen in their clinic in the last week. We found that the survey showed there was about a 31% registration rate. We decided that our target for a registration rate would be 41%. A root cause fishbone diagram and fault tree were formulated, and targets for interventions were identified relating to the systems and tools used by physicians, psychologists, and the patient's caregivers. A pick chart was used to prioritize interventions, and then iterative PTSD cycles were used to evaluate the effect of the interventions. The first intervention implemented was providing an electronic handout to the physicians and psychologists about the state mental health resource offices. The second intervention to implement is creating a checkbox in the EMR Social Health History tab as a reminder to the physicians and psychologists about registration status. The third intervention we will implement is a 4-week follow-up survey sent to caregivers after receiving a call from the D&B Autism Resource Specialist, who provides further information on developmental disability services. The following are our results. As mentioned earlier, we found that our baseline registration rates were about 31%. After we implemented our first intervention, the educational handout, our survey results showed that our registration rates were about 36%. We are yet to implement our second and third interventions. Of note, unfortunately, even though the registration rate increased after the first intervention was implemented, the survey participants indicated that they did not use the handout. Therefore, the increased registration rates were not reflective of the intervention, but as a further estimate of the baseline registration rate. To conclude, our first intervention did not increase patient registration rates, but our second and third interventions involved the physicians and psychologists along with the autism resource specialists and the patient's caregivers. By diversifying the interventions and the people involved in the interventions, our project has increased sustainability and probability of success. In summary, our goal is to improve patient developmental, behavioral, and health outcomes through increased access to care. State awareness of the needs for this special population of children is reflected in the wait lists that are currently present for many of these services. By having caregivers register at their state offices, the caregivers not only are improving their child's chance to get state-funded services, but the registration rates more accurately reflect the needs for funding and advocating for children in these special populations. I would like to acknowledge our other team members on this QI project, including Annalisa Deaton, Dr. Cy Nadler, Robin Jordan, Dr. Sarah Knight, Dr. Meredith Dreyer, and Dr. Sarah Soden. Our reference is included below. Thank you for your time.